Okay. So, good afternoon, everybody, and a very warm welcome to the journal article discussion series at Insightful Pediatric SLP here. And after Journal Club in college, I think this is a good platform where we can discuss new evidences which are present. And I'm very lucky to have the author herself here with me. So, we are looking at something which was published very recently. She will talk about it. So, we are today welcoming Dr. Ramandeep Kaur, and we are looking at oral inferential comprehension of language. She'll give you the name, and I'll show you where the article is available also. So I'll introduce you, Ramandeep. She is the professor and HOD of speech pathology at Father Muller's College of Speech and Hearing. She is the director of Speranza Inspiring Communication Clinic at Mangalore. She holds a diploma, apart from a PhD, she holds a PhD in speech and language. She holds a diploma in child psychology as well as ABA, Applied Behavioral Analysis. She has authored 4 books, and I really, as against the research papers, I've put up the names of the books so that you understand the range of research which is presently going on and the body corpus of data which is available, because a lot of effort, analysis, and research goes into in these books. She has Body Awareness for Children with Autism, Manual and Body Awareness for Parents of Children with Intellectual Disability, Embracing Stuttering, Holistic Child Development, and Navigating Stuttering. She has 15 plus research papers. She has been a faculty at various national level training workshops. She's the academic editor in PLOS 1 editorial board, a Q1 Scopus journal. She's the editor in MethodsX Elsevier journal, again a Q1 Scopus journal, and she's also appointed as BOE chairperson at the Mangalore University. Now, congratulating her on these 2 very recent books by Manipal University Press, Navigating Childhood Stuttering with Springer International. Congratulations, Dr. Ramandeep. And before I hand it over, 1 second, I do want to share this browser window. So I wanted to show you that if you can get the link from me, or I can put it in the chat box here. The link takes you to this page of the journal. It's a free access article. If you wish to read it completely, you can view the PDF here, which will just verify you, so-called you're a human. And the entire paper is available for you to scroll, read. And if you're on a laptop, you can definitely download it here as well. So just wanted to show you this. Welcome, Ramandeep. And
Thank you so much. Thank you. The introduction meant so much. Thank you. So, shall we start? Shall I share my screen?
please do. Awaiting,
Yes.
please do. One second, the screen is still coming up. Yeah.
Then
No, it is still not in the slideshow mode. Wait.
now
No. Yes.
it is. This is slight
Yes,
lag.
yes.
Just a second. Yeah. Is it okay? Can I start?
Yep. Please do.
Yeah.
Please do.
Yes. So welcome everyone. Um, this basically, I did not want to keep it only for the article discussion. The whole purpose of keeping this article free of cost is to spread the awareness that when we are training these children with autism, there's a lot that we probably are already looking at, but still there is a lot that we need to do right from the basic level. So the what I mean by this is when we train these children on, say, the literal language, the inferential language or application of all these literal concepts should go hand in hand. So that's what the topic is about. So it's from literal to inferential language, and here we are going to talk more on how we can have a practical framework for enhancing the communication among autistics. So yes, the article as it was shared, the title is Oral Inferential Comprehension Intervention Program for Children with Autism. This is basically a complete program, a kind of step-by-step program which can tell us what to refer basically when I'm thinking of giving someone an idea on inferential communication. So let's go directly into what this kind of comprehension means. So when I talk about, say, communication, then there are two aspects that come into picture. The first aspect is when I'm talking to people, what exactly is the content that I'm talking about? Is it a direct meaning, or it is something that I should elicit from the message that is being given? For example, this. I think this is now what happened is it's raining really bad since 10 days in Mangalore. And I think this is something very perfect I could find. It says it's raining cats and dogs. So when you talk about literal comprehension, what literally this sentence means is there are cats and dogs falling from the sky. Yes, so this is a literal comprehension. That is, whatever is said to us, we directly take the meaning of that and apply it. These are visible facts. For example, what is the boy doing? What is the color of an apple? Or where is the dog? So, when such questions are asked, we look into a picture or we look into a person and directly answer to that question. So, there's nothing hidden here. What is about boy doing? Running. So this running stays the same. There is no change that's happening. The colors stay the same. So these are visible facts. There is no guessing, no imagination that is needed to understand literal comprehension. Now, in autism, it is simpler, comparatively simpler to understand these literal meanings. So, when I teach a child with autism, it is easier to teach him, say, colors or say body parts or say different lexical items. It is a direct application. When I say apple, every apple is going to look pretty much the same. So, this various researchers show that this particular aspect is easier to understand for children with autism. Why? Because they prefer facts over feelings. They process clear, concrete information better than the abstract ideas. Also, they are strong visual learners. So, when they see things, they directly apply that knowledge to every single thing that they look into. So, it can be direct, it can be a specific thing, or it can also making predictions like what happened first in the story, next this happened, next this happened. So, all this is simpler for a child to understand. So, literal comprehension fits the way many autistic children see and make sense of the world. These are factual, some facts like this is an apple, etc., or it can be something honest or clear. There is no hidden meaning in literal comprehension. On the other hand, here, when I said it's raining cats and dogs, all of you probably very well understood the meaning of raining cats and dogs is not cats and dogs falling from the sky, but it is heavy rain. We all understand this because anyone taught us or not, we basically over the time started understanding various phrases may not be directly applicable. This could have an indirect meaning. Probably when we heard the statement or the metaphor for the first time, cats and dogs, it was difficult to comprehend. How can it rain cats and dogs? So at that point, we started understanding what can be the real meaning. And we slowly started getting an idea the real meaning of this is actually rain. This is nothing but inferential communication. So, over the time, like I said, we all first pick up the literal comprehension. Somewhere around 2 to 3 years, we start understanding various facts and clear meanings of things. Then, over the time, there is something that comes up, which is understanding the hidden meaning of a message that is given. So, application of literal comprehension is nothing but inferential comprehension. Application in which terms? In implied meaning. So, how do you imply meaning of a statement? It could be a non-literal language, it could be metaphors, sarcasms, or any indirect requests. So, when I say, "Oh, you finally come here," so we all understand that I'm being sarcastic. Probably I was waiting for somebody, and then somebody turns up very late. And this inferential meaning that we've taken from the sentence is so the literal comprehension helped us to understand the inferential meaning of that statement. A study by Paris et al. In 2016 says this inferential comprehension is critical for engaging into social interactions. Why? Because as a child who is somewhere around 3 years, who's learned literal meaning of things, his friends over the time, when they reach 5 year level, somewhere they will start understanding the hidden meaning of messages, which is inferential communication. If I want to gel perfectly with my 5 year old friends, then as a 5 year, I should also understand the hidden meaning of the messages which are being shared by these 5 years. So, of course, this is very important for social interactions. One thing. Second thing, the narratives. As we go from simple stories to a little higher level stories, it becomes difficult as a narrative to understand. Basically, it becomes difficult if inferential communication is not being achieved by the child. So it is important not only for interactions, it's also important to understand various stories. Third thing, which probably we never thought of, is the classroom activities. So as children move from basic to complex level, the academic activities, the kind of stories they get, the kind of comprehension passages probably that they read and answer their questions, everything depends upon the inferential communication. So the comprehension should move from literal, something very direct, like this is an apple, to something very indirect, which is a hidden meaning, something like cats and dogs, raining cats and dogs, etc. Also, Norbury and Bishop in 2002 found out that when this inferential communication is not present, or children who are lacking this, it makes them lack in communication. So they face miscommunication, they face social isolation, and also academic underachievement, which of course overall affects their quality of life. So when this is not present, when even a child is talking, the literal part does not really get the hidden meanings of things, they would still have a bad quality of life, though they will be verbal children. This was specifically the need for this study. So, if I understand there is a problem in inferential comprehension with my child really understands the literal meanings but does not get the hidden message behind those words, then what should I do? What should be the step by step level? Which book should I refer? What should I start working from? So what should be step 1, step 2, step 3? How, what manner do I need to go? This is exactly what is addressed in this study. So there's a notable lack of structured evidence-based intervention which aims at this inferential communication skills and leaves a void, a gap in therapy and educational practices. So not only in our therapies, also the teachers find it difficult when we are trying to give an inclusive education to children, say children with autism. Teachers find a big gap in between to make the child understand from literal to inferential. How do I take them? Thus, this study introduces a manualized oral inferential comprehension intervention, which specifically is designed to address these areas specific to children with autism. Of course, it can be used with any child who is delayed in their language or needs intervention in the inferential part. It can be used with anybody, but specifically, this study is with autistics. So, what insight does it give us? This program emphasizes practical strategies which can be applicable to real life situations, ensuring that the skills which are learnt in the therapy setting overall starts transferring into social interactions, even into academic environments and home-based daily communications. So whatever we are doing at our therapy settings through this program, basically we try to push them out of the therapy session to a real life world. So the aim of this study is to develop, trial, and evaluate a theoretically informed manualized intervention for oral inferential communication among children with autism. So this study was done in 4 phases. There was the first phase, which was pre-intervention. So I did it myself. In this, it was a baseline which was taken. So when the children were selected, what is the baseline? How much do they know? What abilities they have at the narrative level? Second phase was intervention phase. So after doing the baseline assessment, a typical protocol, after doing the baseline, there was a training that was given. This training was given by blinded researchers. Then the next one was a post-intervention phase. So after the training got over, there was another assessment that was done. So typical pre-post intervention plan. So there was a pre-baseline taken, there was intervention given, then the Post-intervention, there was assessment done. And over a period of 8 to 9 weeks, the maintenance was checked, whether this scores at pre-intervention stays the same, pretty much the same, at least at the maintenance phase. So last three phases were blinded. The first phase was done by me since I knew how exactly to elicit the baseline. So in pre-intervention, there was assessment before the treatment was provided. So what is the level of the children was seen. Now the problem was when I give stories like Thirsty Crow or Rabbit and the Tortoise and things like that, children will know the story. If the children know the story, if it's by hearted, then how do I get the real baselines? They are already saying something that they have learned in their sessions. So that wouldn't be the real baseline. So I don't really know whether it's a by hearted story or they have learned something or they're trying to guess something. So for this is what was done. There is a story called as Mouse Mystery and the story called as Racing Car. I'm pretty sure you have never heard about these two stories. We'll discuss about it. So these two stories were taken. These are very new stories. So imagine we don't know about these stories. Then of course it's pretty sure that the children will also not know these stories. So why new stories? Because if stories are by hearted, then I am not taking the true baseline for my children whom I'm putting them into the intervention. These stories basically present clear narrative structure, they had visuals. I will show you the stories now, and the potential to elicit the inferential reasoning. These were Indian based stories. Most of the environment that you will see in these stories is Indian based, so it was more relevant. There were no big rivers and things which we don't find specifically in our day to day life wasn't there in these stories. So let's go into detail of what these stories are. If I say culturally relevant, so this is a mouse story. Rats are very common in India. Probably every child must have seen rats and monkeys, and that thing which you see with the rat is a jalebi. So I'm pretty sure these things, the sweets and all that, are generally seen in India. So this mouse mystery story, this is how the storyline goes. So there was a child who saw some rats playing, mice playing at the side, and there was one interesting mouse who wasn't playing with them. This mouse was sitting and eating a jalebi. So this fascinated the kid and he wanted to keep the rat. So what he did, he covered the rat with the jar and kept it there. Over the time, his mom called, like the typical Indian moms who start shouting, "Hey, come down, what's wrong with you? You're not eating your food, and come down, eat some food. I've made some samosas, blah, blah, blah." Yes, so this is how the storyline goes, and the mouse escapes the jar. Then the hunt for the mouse begins, where in between we find a lot of cows and buffaloes on the road. So in between all such things happen, and the monkey uh, sits on the buffalo, and then the boy starts, looking for the mouse. He goes to a vegetable vendor, he goes to various people. In between, he sees a Ganesha festival, and that is where he finds that there is a rat who's sitting and eating jalebis again. So he goes hunting for the jalebis, and that's when he finds his mouse. Over the time, he realizes that the right way of holding on to say, an animal or holding on to somebody will not be capturing that thing in the jar. It's going to be let him free and keep his favorite item there. So this is my version of the story. This is so what we did is we made this story. We asked an artist to design these visuals again, and then we did a lot of content validation and all that, and then we came up with this particular story, and we did the baseline. Similar story is Racing Car. So like this, there were again the story goes on. The child is very happy. So basically, these stories give a lot of emotions. At the end, there is a message that is given. This when you see the pictures, what we are supposed to do is you see the pictures and you try to guess what probably might be happening in these stories. So we don't in the baseline. It was not given. It was not told to the child. First, the child was asked to make assumptions. Let's say what's happening. Let's describe the pictures and all that. And based on that, then over the time, the story was told to the child and seen whether he understands or he gets the hidden meaning out of all these. So this kind of stories. So mouse mystery and racing car story was used for the pre-intervention level. How did the procedure go? First, the story was presented, then NCA was done. I will discuss on what NCA is. Then a response recording was done. NCA is a narrative comprehensive assessment which follows, now this is a Western study which follows this squirrel story. So they had a squirrel story and they had a similar pattern. The stories which are made also follows a similar pattern of stories. There are no wordings there. There is no learning as such. It's only based on the pictures. The child is supposed to pick up the meanings of, so he's supposed to describe the story and pick up the meaning out of all this. So the NCA, the original NCA is by Paris. So these are the studies. Probably you can note it down for reference and read a little more on this. So this is the actual NCA, the Western one. This NCA was developed in the Indian setup, standardized and then used. So the first level is story presentation. So when you give the book, basically whether the child has book handling skills, whether he's able to engage into that. So based on all these levels, whether he comments on the picture. So the first thing that was done is after presenting the book, you start scoring the child on whether he knows how to change the pages, whether he knows what comments to make and all that. And according to that, he is going to be scored. Then comes the NCA task. This is the NCA task. So NCA, narrative comprehensive assessment, is nothing but a combination of literal and inferential questions. So these questions are asked specific to the story. So if I have racing car story, I will ask with respect to page 1, page 2. So look at this page. Who are these characters? What do you think the story is about, etc. So it includes literal questions and it includes inferential questions, and you start scoring the child based on what responses the child gives. There are about 20 questions here. So this NCA was developed for each story and then it was given to the kids. So this was the main part of this paper. So what we did is there were 20 questions. We actually standardized it and gave it. So the highest scoring is 40 and accordingly gave the scoring to the child. And then later on it was compared. So when you see post intervention, this is what was compared. So a comparison of NCA is what was done, whether the inferential scoring increased, literal scoring increased, what exactly happened after the intervention. So this again, we are still at the pre-intervention level. All this was done before the intervention was started. Then the intervention came in. What was this intervention? There were 8 weeks of training sessions. Training sessions were typical, are half an hour to 45-minute sessions in a week. This was given by trained speech language pathologists. What we did here is generally the sessions would focus shared book reading. I will go into details of all this. So there will be shared book reading, there will be story map creation, the complete retelling of the story, discussing about the characters' emotions, their personal experiences, and what is the outcome of the story, the discussion about that. At any point, at every point, it was seen that the therapist does not give his or her opinion to the child. Instead, we tried to generate the opinion from the child. If I want to change a response, if he said, very good, the rat should be inside the box. If the child said something like that, we would not say, no, that is wrong. You're not supposed to say that. Instead of that, there were ideas given. Okay, how do you feel? If you were inside the box, how would you feel? So these kind of predictions, story outcome discussions, etc., were done to make the child understand that you can make wrong inferences from a story, but let's try to make more moral based inferences. So, the stories that were used during the training, the stories which you saw, Mouse Mystery and Racing Car, if we use the same stories in the intervention, there is no guarantee that the child is going to learn these stories and give you the true outcome for the other stories. So, we did not try to include those stories here. So, we kept those stories only for assessment so that after the intervention, when we are trying to reassess the child, we are sure that this thing is applied to all the stories that the child has learnt. For that reason, there were other Indian books which are easily available on Amazon. We bought those books and started training the child. There was only one thing that was kept in mind is these should be some stories which are number one, Indian based so that they can relate to it because the whole outcome should be them relating to their personal experiences. So it should not be an Western story because an Indian child will not be able to relate to something like a bear and all that because we don't see those things here. So these were Indian stories, number one. Number two, there should be something some moral or some emotions, so that the child can relate to these things in future and elicit this non-literal language. So one story was this. This is easily available on Amazon. So probably if somebody is planning to use this, you can use these kind of stories. There is another one, The Clever Tailor. So we took four stories. The donkey story, the first one, then the clever tailor, then there is Amachi's glasses, and my favorite is this Gajapati Kulapati. So all these stories, so this elephant here, he starts getting cold in one story. In another story, he has a stomach pain, etc. Something that we generally see children falling into. We generally see them falling into a cold or a stomach pain, etc. So they can very well relate to this elephant and the experiences the elephant is having. So these are the stories. So we took these stories this way. There was intervention weeks. So the first 2 weeks followed the donkey story. We kept on talking about the donkey, what experiences he had. Let's read a story, etc. The next 2 weeks were with Clever Tailor. The next 2 weeks were Ammachi's glasses, and last 2 weeks were Gajapati Kulapati. Now, so 2 weeks, 2 complete weeks of one single story, very, very boring. So we did not really expose the child too much to the story. Instead, these were the targets taken. So there was narrative retelling, like let's see the story and let's try to describe the pictures first thing. Or it could be coherent schemas, which is child's mental blueprint structure for understanding and organizing the story. So what does the child thinks? What schemas is he making? What he thinks could be happening in the stories? There were dialogic book sharing. Of course, the book was shared, and then there were literal questions asked, or the information was given in various ways. There were open-ended inferential questions. As we all know, theory of mind. So there was an integration of some questions where he could feel what the character is feeling. So theory of mind. Think aloud. So the therapist would think aloud and say, I think this is what is happening, etc., and help the child to understand, predict, or make inferences. Rather than just again imposing something, no, he has a cold, you're supposed to say this is what is happening. When I do that, I am focusing on factual information. We are not trying to elicit a fact. We can see that he has a cold, but we are not going to tell the child he has a cold. Look, this is a cold. No, because cold cannot be looked, or how the elephant is feeling is not a fact. It is an information that I should elicit from the story. It's a hidden information. So through think alouds, through personal experiences, etc., these things were helped, the child was helped to elicit these things out of the story. Then there was scaffolding, the temporary support. So basically scaffolding is nothing but some fill in the blanks, or some, some things that you leave out and the child is supposed to make predictions on. So all these strategies were used. There were graphic organizers, story maps. There were introducing the second tier vocabulary. Like they generally know the everyday vocabulary. Everyday vocabulary will be elephant, donkey. These will be the everyday words that they are using. Instead of this, there was a certain different words which were used. Like the elephant was very frustrated. He repeatedly kept sneezing. So this is what made him very upset. He was comparing himself to the other animals who were not, having a cold, etc. So all these second tier vocabulary were focused more, because these are higher level, and the child, when they have to have a social communication with their peer mates, they should be knowing this vocabulary more than the tier 1 vocabulary. So all this was focused, and specifically meta narrative awareness was being elicited here, which means the structure, components, and purpose of a story. So components like the grammar, the whole story structure, the narrative quality, the perspective of the characters in a story, the purpose of a story, like the moral, etc. So all this is what was elicited more. So though there were four stories, the targets were these over all the four stories. So there's no hard and fast rule that I should be taking just these four stories. I can pick up any storybook which is related to the emotions and a little higher level. We can basically target stories which are for, say, a 5-year-old or 4-year-old, and accordingly start using this treatment program. This again is important. These were the story maps. So when a story was seen, this hand-drawn maps were given. So for the child to make understanding about this meta narrative awareness. So this is the first thing that happened. Next, this happened. So either it could be in a picture form. Little higher level would be this form. This is again, the characters were this, the setting was this. So it can be, for example, if it's a thirsty crow, the setting is going to be a hot day or a hot sunny day, etc. So what the setting was, who are the characters in the story, where did the story happen, etc. How we look at things is, we do not see thirsty crow as thirsty crow. We do not see a crow who's putting stones. Instead, we see deeper meanings, like, okay, it was very thirsty because the crow was thirsty, wanted to really drink water. So we go deeper into that. So a setting, where it happened, when it happened, the characters, etc., is what we see. We can take it to a little higher level after that. So it starts with a basic picture description, then it goes to higher levels like this. What was his first attempt? Probably he tried to put his beak into that jar and tried to drink. After that, he could not drink. So then what could be the second attempt? What did he do next, etc. So making a pattern of this sort. So basically, all this comes into story maps. So the focus was, again, I'm repeating, the focus was less on the story. The focus was more into these kind of maps and eliciting the hidden meaning from the stories. Delivery, how this happened, it was a RCT. We took 50 participants. Now, from these participants were recruited from my center, Speranza. Specifically, we had a very small sample size that was required here. So we actually went over the sample size and took the participants. Typically, what happened, we took just 20 kids, put them as 10 in each group. But then the need for giving this intervention to more kids started arising, and we made it to 25 per group. So the participants who were there, they were 4 to 6 year old kids. Specifically, the chronological age was not important. Their language was somewhere around 3 to 6 years. They were mild to moderate autism. We tried not taking the severe autism because probably it was difficult to control in parameters like behaviors, etc. So the exclusion criteria was anyone with articulation problems, phonological disorders, or neurological disorders, or behavioral problems. These were excluded from the study. So typical participants who are around mild to moderate, who would understand stories and make let's say, theory of mind was easier to elicit, such kind of participants were taken. They were allocated into 2 groups. There was inferential comprehension group. So this was the group whom we were training. There was a second group, which was a control group. So among the kids who were coming to the center, among those kids, we just divided them as, we are going to give this training to 25 of these children. We are not going to give this training to the other 25, but these 25 will follow the traditional pattern. The traditional, what we teach, the literal we teach, and after teaching literal, we also teach stories. So there's nothing that we were changing out of this, or we were not. It's not that we were not training them on stories. Traditionally, what therapy was going on with the cards and all that continued for the control group. Just for the target group, this particular intervention began through the maps, etc. So this went on for a specific period of time, after which we did a post intervention. Now, when we are doing post intervention, these 4 stories were not selected. Instead of that, one story that we selected was Mouse Mystery. So, what I found is, by the time the pre-assessment got over, kids were very used to those stories. So the pre-assessment itself took 2 to 3 days. During this time, the kids kind of knew the story, and when we did this Mouse Mystery, they were giving a lot of responses with their memory. So we brought another story, generally this frog story, as you can see in the picture. This is frog story, very similar. Generally, this story is the one which is used in a Western setup, but in a lot of researches. But it was pretty much similar to the Indian setup. So we brought in this particular story, we replaced it with the racing car. So one previous story was taken from the pre-assessment, and one another new story was taken to see when we are assessing them post-intervention, whether they can apply this aspect to other stories, something that you have never seen, whether you are able to make a story map, whether you are able to understand things even with a random story. So that's the reason the frog story was taken. If you are confused, this is a program overview. So basically, intervention group, control group. Intervention group underwent pre-intervention, same intervention phase, post-intervention, and a maintenance. Same thing was done with the rest of the children. So the first thing which was done is the donkey story. Then we went to Clever Tailor, then Amachi, then Gajapati Kulapati, and all these areas were noted. The next column, narrative retelling, all that was done for the intervention group. What did we do for control group? Basically, the traditional therapy. Nothing changed with the cards, with the inference making cards, reasoning cards, all the therapy related cards, we continued like that. So there was lexical development, there was grammatical structures, even there were training on articulation, pragmatic use. So they have to say hello to each other and things like that. All that continued. Generalization was also there in real life. Now, I must mention, even in control groups, sometimes we were using certain stories. So traditionally, we generally use, let's say, a thirsty crow, or we use these kind of stories which are known to children. So this continued. So story telling was there in control group also, but the areas that you see, the narrative retelling, etc., in this pattern, it was not taught. It was taught in a very traditional way. So the results. Literal comprehension. So first we'll talk about what happened in terms of literal comprehension. So you remember in NCA that we saw, we had questions on literal comprehension and we had questions on inferential comprehension. So now we had two groups, inferential and control. So when we did post assessment, we checked after training them for so many weeks, what has changed in NCA. To our surprise, what we had, the hypothesis was their inferential scores would start increasing. But what we saw, as you can see, is pre-literal comprehension was 5.4. After that, the post comprehension started increasing. Even at the maintenance level, it was more. This was pretty predictable. Yes, the literal scores would increase. But you can see that in the control group, there also the scores have increased, but the scores we got for the literal comprehension in the experimental group, they were much higher than the control group. So no doubt through this training, they were picking up on inferential, which we had thought they will start, learning on the inferential part. So that inferential comprehension probably would increase. So keeping that at the side, the literal comprehension also was more when compared to the control group. So in control group, the scores, yes, it improved, but it was less than the experimental group. Next major thing was inferential comprehension. In inferential comprehension, when we scored them down, the control group, as you can see in the red line, were at a higher level. So they were actually performing. Now, this was not very significant, but yes, they were performing slightly better than the experimental group. Over the time, when at T2, so post assessment, when post intervention was done, the scores of the experimental group, now I'm talking in terms of inferential questions. So, on inferential questions, the experimental group started showing better scores. And this was maintained over the time. So though the control group started at a better point, the experimental group went way ahead the control group and they started making much more inferences and their scoring at NCA started improving. Overall, so at T1, this is our T1. At T1, it was seen that mean inferential score for experimental group was lower than the control group. This indicates that the initial scores for both the groups before the intervention were pretty much, so it was less for the control and more for the more for the control and less for the experimental group. But in T2, when it went, the control started performing less and the experimental was more. And at T3, which was maintenance, when the therapy was not given specifically, then what is happening? It was seen that pretty much the scores remained the same. Yes, it went down a little for a certain things they did not perform very well, but still it was pretty much the same. The difference between the two was not specific. So the maintenance was done. Method validation. So how good is this method? So at the end, we also did an inter-rater reliability with 10% being scored by random speech therapists. We also did a standardization. So to prove that this method is or the stories are good enough, there are studies which were done on typically developing children where we saw that these are the stories. So they are basically standardized and they can be used with that age group. So there we saw that there is a strong reliability at that point for this program. Statistics basically showed that there was a high significance between the two levels. So it was significant difference between the control and the inferential groups. Most important. So I would like to highlight this. So what is important is we need to use this kind of therapeutic intervention. Probably as speech therapists, we are already using, or we are, trying to teach the child the stories which we are picking. But what we need to do is these story maps, we need to use this meta narrative skills, the awareness for the child to elicit the hidden meaning in their day-to-day life. So we need to use this every day. Not only us, the parents need to use it, the teachers need to use this. So rather than telling them the story, it should be less than the factual information. It should be more that the child starts eliciting the information from this area. Also, we need to use more Indian related stories. So, in our therapy setup, it should be less of the Western stories. Of course, we can use those stories also. There are very beautiful stories that we get about bear and things like that. But the initial level, it should be these stories which are specifically used so that when I have to relate to something that's happening in my real life, it is easier to relate. So, as an autistic, it's very difficult to relate to something that you haven't seen. So it should be done at an Indian, culturally relevant stories. There were limitations, no doubt, at this. Like we couldn't do this program with the severe autistics, number one. Non-verbal autistics like AAC level, you can train this AAC kids also with the stories. But with a program like this, it's a little difficult to train the non-verbal children. The stories which I actually found is that the stories I selected, they were Indian based, but this specifically gave a lot of North Indian effect. Even the jalebi and things like that, it's more to do with the North India impact a little more. Like the tailor used, so the second story was the clever tailor. There were a lot of words which were similar to something like Odhni, which are similar to Hindi language. So it was very similar to that, but I did the study in a Dakshin Kannada. So I did it in Karnataka where Odhni word is not used. So certain things I had to really change it for the child. So there could be biases at that point because I'm not using that word. Of course, in mouse, mystery, racing car, and the frog story. So the assessments we made, all this didn't make a difference, but still there, the story selection was one of the limitations. Consistent setting. Yes, when we do these things, there is, the program may not be very effective at every clinical setting. Specifically, if it's a private practice where you have so many kids coming in, it's not easy to keep using the same stories. Also, like I said, 2 weeks, one single story. So a lot of times the parents would not be very happy when same things are being done in the therapy setup. So there is a challenge. So that's one of the limitations. And there are a lot of abstract ideas here. It takes a long time to teach an autistic child these abstract ideas. So probably sometimes it goes, of course, the scores got better, but I feel a lot of times in my experience, things went above the head for a child who's with autism. So the abstract ideas are pretty much a lot. So at that point, things were a little difficult for an autistic child to understand. This is the overall abstract for the article. I would like to say this. As we are training the children on the literal comprehension, while literal comprehension gives the child the words, what they are supposed to speak, inferential comprehension is going to give them the understanding. So they have literal words, but inferential comprehension is going to give them the actual understanding of those words. So for children with autism, teaching both, not one after the other, not let's finish literal first, then to inferential. Instead, instead of that, teaching them this side by side will open the door for knowing what happened to grasping why it really matters. So the facts are important, but apart from the facts, it's important to constantly teach them how to elicit the indirect meanings from these facts. So we need to start with something that is very directly seen and then move to something that is not seen. So literal and inferential teaching must walk together. One will ground the child and the other one will help them grow better. For example, a session plan for an SLP can be something related to this. We can pick up any picture description. We can start doing the shared book reading. A lot of researches show that shared book reading gives a lot of social interaction, gives that point-to-point understanding to the child of being with another person, the social interaction, which is lacking in autistics. So there should be something like a warm up you give with a picture description. Then you start doing a shared book reading. Tell them various literal areas in that story. Then at the same time start teaching them on inferential comprehension. Then through various scaffolding tasks, etc., we can elicit both the areas, literal as well as inferential. Takeaway for this would be literal comprehension is the starting point where we should train the autistic children for the facts and clear visuals. But real communication, so the problem with autistics is socializing. So they probably will not generalize the literal things that they are learning to the hidden meaning. So that's the reason the real communication is going to be at the inferencing level, like feelings, intentions, etc. Story-based interventions like these are going to target on how to elicit these feelings. So NCA framework, basically the chart that we saw would help us to assess as well as treat children in this literal and inferential comprehension. Teaching both these areas together, again, I'm highlighting not one after the other. So teaching both together builds the language for life and not only for the language test. So many a times I have seen that literal comprehension starts increasing and in our language test, say SLDC or ALD is going to show good scores, but the child will not be able to use this language in real life. So not only on the test, such kind of interventions would help them to get better quality of life later when they can use this in their day-to-day life. Thank you.
Thank you for black backing clinicians. You don't know what a gold mine you have, you have really struck. Thank you, seriously.
Oh, I
So,
really wish people start using this because I had this eye opener. So when I did this with, like I was telling you, I did this with one child, and then I had this literally lightning struck feeling that, oh, he's really responding. So why not do this on more children?
children, yeah. Will you stop sharing? Then, even
Yes.
I want.
Yeah.
So for private practitioners, why this is really a gold mine is, you showed us the results that can happen, and it is so customizable because you did it on children who are on the spectrum, so that automatically goes to show that they had various levels of cognition. You obviously did not do it with typical children where when you say 5 years, you understand कि चलो sarcasm वगैरह समझ में आता है. So for the for audience is open, please type in questions. You can ask her directly that what you want to is completely up to you. You can discuss, you can ask further questions. Till then I'll continue discussing with her. So for because you are also in private practice, you realize how important it is to keep training the children towards
Mhm.
it.
Yes.
you
I
know
would like to highlight on that since we are
yeah,
in
yeah,
private
sure.
practice, like I told you, the most problematic factor was you using the same story with my child for 2 weeks. So
Correct.
to get that idea or to tell the parents that it is not this book that I'm using, what I'm using is this paper. So this strategy, this strategy, this strategy. So the
Absolutely.
lesson plans are very important. So we need to highlight and keep that first 4 days. I'm going to target only this. So this is what gives the confidence to the parent that though it is one book, the target plans are
Absolutely.
different. Yes.
You have a question. Was IQ
Yes.
a control variable? Did you consider IQ?
It was very difficult to do that. So what we just saw is
Yes.
these
The
children, since
language.
we already, yes, the language was one thing. They should be early learners of English because everything is going to be in English. So they should be taking
Correct.
therapy in English, all that. Next thing should be the mild to moderate autism because anytime you take severe autism, again, it would, be the other direction. So taking IQ as a variable to make it specific was very
Correct.
difficult. So what we just did it, they should have mild to moderate IQ level. If they fall into that range, that is okay.
Yeah.
If they had severe issues like they're not understanding all that, then they were excluded from the study.
Yes.
One of the limitations, we can call it one of the
Yeah.
limitations, no doubt. But again, in autistics, it gets a little difficult to take IQ as a parameter.
Yes, because it makes it unidimensional, because then IQ is not an indicator of the behavior, special
Yes.
interest,
Hmm.
language capacity, that kind of a thing.
No.
So,
So when this program is being used, I would suggest keeping this at a corner. We should specifically target the language age. So as I said, for any normal kid, around 3 years is the time your literal talking is done. So you start understanding everything literal way, and you start developing your inferential part. So somewhere around 3 to 6. So the major thing that was paid attention is the child's language course should be 3 years minimum, and it should be
Correct.
somewhere at that 3 to 6 years. So this is the time, the right age for us to start training him on the inferential part.
So between 2.5 to 3.5, generally they start with I'm talking about neurotypicals. They start with
Yes,
two-way communication. They answer you coherently. They stay on the topic. And I think something
correct,
which has been stamped very in an indelible fashion on our brains is at 4, through college, I'm saying, at 4, a
yes,
child is linguistically an adult. They can lie,
adult,
they can manipulate. And for certain
yes,
children, it is actually lower. Children who have a larger social exposure, who have larger, family, not screen exposure, family
correct.
exposure, more exposure to adults, more
Hmm.
number of kids. These children, I am seeing them, when we take them up for articulation, they have it at 3.5. They're able to lie, manipulate. So, the kid is linguistically an adult. Does
True.
this encompass principles of neurodiversity?
I
Is
didn't
it
really.
in the
What exactly?
affirming? Huh.
See, what happens is neurodiversity. Basically, what happens when we are looking at a language parameter, at a child who is autistic, social is something which is going to be a problem, anyways. We try, as practitioners, we typically try a lot to give them social interactions, to give them group sessions and things
Huh.
like that to cut out or to reduce this social problem and start making them to communicate. For children with neurodiversity, already we do so much of socializing through shared book reading and through, this kind of implied meaning kind of things get better. So of course, when you go from a neurotypical to a neurodiverse child, these are the things apart from this program we should continue to do so that socializing as a parameter keeps increasing. And in my language sessions, I'm trying to focus on inference making through the social areas.
I can help Anvita's question. I'll just share one of my pictures just to understand that how do we lead this population into understanding that, to get to the results that you have shown. And even though you're working at book, I'll just show you something from the Bloom with Us collection. And because she specifically said, is it ND affirming? I trust me, if you show this picture to a individual on the spectrum, they will not be able to understand that this child is hurt because of a social implication of the child's toys being broken. So the mapping that she showed you, like to do it on the paper, if 1 second, you start with this, that how you have got hurt, because this is reality, this is a physical hurt, and that the child is crying and the mum is not crying. This is the first level of inference. If you're able to work through this in private practice, you can achieve the results Dr. Ramandeep just spoke about. So the child is crying, getting the differentiation that the mum is not crying, the mum is worried. The mum is worried because of the child's action reaction jo hua hai idhar. And then you get them to a social situation that some other friend who is not in the picture has broken the toys and this child is crying. So I make it a point to show the child that, oh, see, I can see no blood. I can see no blood in the mom. I can't see any blood on the child. Why do you think this kiddo is crying? And again, something, the child has done something wrong and the mom is scolding. Again, there is no hurt, nothing. But these are social connotations, like you said. If worked through this, if worked through this, you will be able to generate those kind of responses really spontaneously in a generalizable manner in the stories which she showed. So if this initial training, this is how you work in like private practice. You don't jump and you get the results in the story. So 1 second, Anvita has written, I understand the mapping. I completely get it and do it all day. However, it would be more about working through multiple perspectives. Absolutely. Absolutely. So basically getting the ones which I had outlined there, the narratives and all can come through so many different things.
Anvita, there's a lot that's the reason there were so many things that was, done. So it
Yeah,
is think aloud, you need this. So many steps that we need to take, and it should not go step one, step two. It should always go everything at once. So the
yes,
more, like, yes, it is multiple perspectives that comes into picture, and
yeah,
we need to show, see, every picture is going to have multiple perspectives, and these, especially these emotion cards, or let it be the story. So anything like that, we need to show every perspective. This is what is not there in literal comprehension. So literal comprehension is going to have a shape, a color, and that's it. So whatever is round in shape and red in color is going to be apple. So something like that. But in a picture, there could be a blood that relates to something else. There could be a toy broken that relates to something else. And we need to see and look at every perspective. So through programs like this, we should actually show to the autistic child,
hmm,
again, not tell them the facts, but show, let them see the multiple perspectives. So we need to not teach them what to see, we need to teach them how to look at these multiple perspectives. So if the picture changes from story to an emotional card, you should still be able to elicit the same kind of
yes,
inferencing over
yes.
different areas.
And I'll give you another example where it can be implemented really early for, like you said, on for all kids on the spectrum, so that the quality of life changes, is the daily schedule. So the two lines of thoughts that you can have, that we may land up going to swimming today and we may not land up going to
Random.
swimming today. If you start with this through the visual schedule, when you're training the parent at extremely initial stages, the child learns to observe much more from the environment, and you are pushing them towards more inferential learning, that it is not everything what is there is not labeled, that is just there, but there is a lot of, because the parent is making decisions based on several inferences, and the child is suddenly lands up without a plan, or a sudden change in the plan. I agree. My question is, instead of labeling this as description, shouldn't we label it as multiple perspectives so that it implements and works more on their ideas? Absolutely.
Yes, yes.
Absolutely. Through your daily session, through your daily, ADLs, if you're working with mom, you have the child going and putting the towel in the washing machine, for example. And one day, or through one incident, the mom or a family member says that, don't put that. I have just replaced it before your routine. Can you keep that there and take the other towel? And the child will not be able to, or an individual will not be able to process it. So, yes, through multiple perspectives, if you continue this and you are able to, show these micro detailing on one small piece of drawing, like she showed for a story, if you're able to do this, it opens up the child, drastically. I'll I'll uh, I'll share one small example that we just did it, and it worked phenomenally with a child with whom even shared book reading is very difficult with the child, given the language and the cognitive level of the child. He was upset because the store beneath the clinic was closed where he wanted chips. Just getting, just drawing on the whiteboard that the shutter is closed, we need not go to another shop. And I was not giving any defensive answers. We'll go after the class, we'll go to the shop near your house, nothing. Just drew on the whiteboard, shop is closed. Actually drew the shutter, actually drew the chips ka packet, and I showed by the this is closed. We did not understand with our eyes open whether it was closed or whether it was open. When you stepped out of the auto rickshaw today, it was closed, and we can try to be okay with it. Just acknowledging the individual's anxiety through this visual map that she said, it is dramatic. It is a dramatic intervention strategy if you wish to employ it. Please do.
Yes, Anvita, that's, I just read your comment. That's exactly why I mentioned that autistics are visual learners. So many a times we make this mistake. We keep reasoning out. We keep telling, like you said, you didn't reason out today. Instead of reasoning out, you just gave a visual clue. This is what is happening. Finished. So instead of reasoning and making things more complex in their head, you just gave them a visual card. This card can be used at every point. In fact, it should be given to the parent to train him even to make predictions. When it is closed, this may happen, etc. So,
Absolutely.
yes, it's
Absolutely.
no doubt visual.
And that can be that can be done for everything. Like I showed you the picture of a child getting physically hurt and the child getting upset because the toy is broken, the mom getting angry because of the child's action. And so true for both children on the spectrum as well as children with ID. And the child not realizing that it was my actions that brought forth that reaction from the mom. It is really tough for them.
In that case, I would like to go slightly away from this topic. Now, when we constantly train them on this drawing schedule, what really
Yeah.
happens is over the time, see, the autistic is not going to become completely normal when they turn 10 or 12 years. So, we are going to have this
That is the
component for
ND
life.
affirming. Right, right, right.
So that is where, see, when the body safety and all that comes in, something has happened with me in the bus. I need to tell. I don't know how to say this. As a normal, we don't know how to say this to our mothers. So as an autistic reporting, this is going to be even more difficult. When since your childhood, you're being trained at this visual cards, it's
Yes,
easier for me to draw and tell you what happened in the bus. I can just
yes.
draw a bus and say wrong to that, and the mother will get the feeling that, okay, there is something wrong with that bus. So we are also training them for future.
Expression. Yes,
When you don't
yes.
know to report, you report through this.
Yes, yes. And there are
Yes.
various methods. Like each child will show you some different method of,
Mm.
telling you this, that either no to the bus or, because you gave this example, one of my kids continuously kept taking my hand like through the session and kept putting it on herself. Took us a day to understand this because then some other report came in from somewhere else. And then when we understood why was she randomly touching anywhere and then she was giving a reaction, she was taking an adult's hand, touching anywhere, everywhere, and was giving a reaction. We were not able to put two and two together. But when, some issues with some other parents came in, the parent put two and two together. The first thing we do is we drew it out for her. In the
Mm-hmm.
bus, there was this happened, and we would not like to go to the bus. The child looked at all this and cried in the mother's arms. No tantrum,
Um,
no meltdown, nothing. True expression of, what has happened. So
it's
these are
happening
training techniques. So that's what I told you. Your research is gold mine in saying that, what we are doing in private practice is you
every
just
day.
validated that.
Yes, is validated. Exactly.
Yes, sure, Anvita. Thank you for participating in the discussion and, sort of enriching this. We always learn from each other. And it is always a great joy to have the author herself over here.
No, it really helps us to. So in our papers, things are very limited. Like you have limited number of words and things like that, and you want to say so much to
Much
SLPs
more.
in your experience. Yes. So article discussions like these really give us that domain to, keep talking and telling what I have felt.
Absolutely. Absolutely. So, Ramandeep, I'll just quickly show a site of the website because individuals can go and access this later also. Like for any other SLPs you wish to share this, I'll just show you. This is what Insightful website looks like, and you can access all these. These are free things which are there in the blog section. So it will be uploaded here by maybe tomorrow, day after. All this is free. You can access a lot of blogs, case discussions, article discussions. A lot of this can be accessed right over here. And if you are interested in any of the courses which have already taken place, then you can definitely go here, create an account and add this to your cart. A lot of niche topics are made available to you. They are kept here. They are going to be here for a lifetime till the website is there. So just getting all you guys aware about this. And finally, thanking Ramandeep for her time, experience, and you see, she's an HOD at Father Muller's and she had the time to do this with us. So thank you so much. This is a small token of love and appreciation for you for getting, and it is a
Thank you
recorded
so
session.
much. Wow.
And it is a recorded session. So we hope it reaches more SLPs and they learn these techniques and they start employing as in how, this is available. I'll send this to you personally. So thank you so much. It was really great, and we managed to even wrap it up in 1 hour. I think that suits
On time.
everybody's time as well.
Yes. Thank you, really. Thank you so much.
Thank you, everybody, for being here on a Saturday afternoon, participating. You can get through to her. You can get through to me if you want to get through to her. Please, if you want to discuss something, ask something, she's always there.
There.
So
Yes. And I've shared my number also, so please, you can get in touch anytime.
that was really generous. So thank you, everyone, for being here, and we will wrap it for the day. Bye.
Yes.
Bye,
Thank
everyone.
you.
Thank
Bye
you.
bye.